Hi, Dr. Goldberg here, continuing our infectious disease lecture series. Today we're talking about an update on community-acquired pneumonia in adults. I'm going to be reviewing briefly an article that was published in the New England Journal of Medicine in the summer of 2015. CAP is still a leading infectious cause of hospitalizations and death among adults in the United States. This article looked at about almost 2,500 adults who were hospitalized with pneumonia in a couple of large urban centers. What's unfortunate about this study is that a etiology of CAP was only found in approximately 38% of the patients. Now, this is as we look back in retrospect, CAP normally we can find a pathogen in, according to old literature, about 65% of the patients. But now we're looking at finding a pathogen only in 38% of the patients. If we look at the most common pathogens that were isolated in CAP, 9% human rhinovirus, 6% influenza, and strep pneumoniae, only 5%. For people hospitalized in the ICU, the pneumococcus was number one, then Staph aureus, and then the Enterobacteriaceae. Bacterial pathogens that were only detected in about 14% of patients. So I think this is a good article for us because it tells us still that we don't know a lot about what causes pneumonia in our adult patients who are sick enough to be hospitalized. It also documents the fact that we as providers need to be more conscious of giving patients their influenza vaccine as well as keeping them up to date on pneumococcal vaccines. There was also a call to develop more effective vaccines for RSV, parainfluenza, and human metapneumovirus, which are other sometimes causes of pneumonitis in adults, which are sometimes more difficult to diagnose, especially the human metapneumovirus. So, in conclusion, CAP is still causing us a lot of grief. And now we can say that over 60% of patients we don't know really the pathogen. So, Dr. Goldberg signing off.